surgeries will naturally bring about blood loss, but what the surgeon or the anesthetist or the whole surgical team does not want is that you lose blood outside the limit of safety. So, in conjunction with the surgeon, it is also the function of the anesthetist to assess blood loss so that if there is a need for blood transfusion during surgery, the anesthetist can transfuse you. The fear of sleeping and not waking up usually prevents many people from not going through surgery, especially when it comes to elective surgeries like appendectomy and elective CS, cosmetic surgeries like tummy tuck, liposuction, BBL, or aesthetic breast surgeries. In this video, I'm going to be discussing briefly everything that you need to know about general anesthesia in aesthetic surgery. Now, the purpose of anesthesia is to make you pain-free and very, very comfortable during surgery. The person in charge of anesthesia during surgery is referred to as the anesthesiologist, or simply put, the anesthetist. The anesthetist has three functions in your surgery: to put you to sleep, make you safe while surgery is going on, and to wake you up after surgery. So I want you to stick with me to the end of this video so that you would understand everything that has to do with general anesthesia in surgery, especially if you intend to go through a liposuction, a BBL, a tummy tuck, or any form of elective surgeries at all. Once you've been scheduled to undergo a surgical procedure, you would have a pre-anesthetic review, in which case the anesthetist will come around to review you, usually the night before surgery or very early on the day of your scheduled surgery. His pre-anesthetic review would involve a number of things. First and foremost, he would need to know everything about you, especially your medical history. So he wants to know if you are hypertensive, if you are diabetic, if you are asthmatic, if you have sickle cell, if you have seizure disorders, or any other relevant medical history that you might have had in the past. In line with that, he wants to know if you have any drug allergies, if you have any allergies at all, or if you have any drug reaction. Again, he wants to know if you've gone through surgeries in the past. If you have a past surgical history, he wants to know the nature of the surgery, the nature of the anesthesia that was administered to you for the surgery, and if at all you reacted to anesthesia. Number three thing that he would want to know about you is your social history. Do you smoke? What do you smoke? How heavy are you on smoking? Or do you take alcohol or any form of drug abuse at all? Because these things are very, very relevant to its function in putting you to sleep, making sure you are safe while surgery is going on, and waking you up. Now, your surgeon in preparing you for surgery would have taken your blood for laboratory investigations. He would have reviewed it. The anesthetist will also review the results of investigations that your surgeon had done on you to be sure that you are fit and that you are safe for this elective surgery. He would take your vital signs, your oxygen saturation, your temperature, your heart rate, which is your pulse rate, and your blood pressure. All of the parameters of your vital signs must be very, very normal. They must be within normal range to be sure that you are safe for surgery. The anesthetist will go ahead to do a relevant physical examination for you, especially assessing your throat, your neck, and your airway. Once it's done with that, the anesthetist would discuss with you the pros and the cons of anesthesia, the good, the bad, and possibly the ugly sides of anesthesia, by which I mean the side effects and possible complications of anesthesia, what to expect, and if at all in rare cases these things occur, how they manage it, so that you are safe eventually in the course of surgery and even in the immediate post-operative period. The night before surgery, if he assesses you and he realizes that you are anxious, he will go ahead to give you something to calm you down, to make you relax, to make you sleep well, and to allay your fears and your anxiety, just to prepare you for a successful surgery the following day. Finally, they will instruct you to fast the night before surgery. At least 8 hours before surgery, you shouldn't take anything by mouth again, either food or fluid, except in cases, of course, where you are on special medications. For example, antihypertensive, oral hypoglycemic drugs for those who are diabetic, antiretroviral drugs for those who are managing HIV. These drugs, you'll be permitted to take these drugs the night before surgery. And for those that you will need to take on the morning of surgery, they would instruct you to take it with a sip of water. If not, you should be fasting some 8 hours before the time of surgery the following day. Now, what will general anesthesia do for you? Number one is unconsciousness. Number two is amnesia or loss of memory. Number three is analgesia. It means you are going to be completely pain-free. And number four is muscle relaxation. These are the key components of general anesthesia. Now, on the day of your surgery, to put you to sleep, the first thing the anesthetist will do, if you do not have an IV access, is to make sure that he secures an IV access for you. That is a cannula through which your medications will be served, through which intravenous fluids will be given to you. Once it's done with that, it reassesses you again to be sure that finally you are fit for surgery. It checks your vital signs again, your oxygen saturation, your heart rate, your blood pressure, your temperature, and every other thing that it would need to check. So once that is done, it's going to start by giving you IV fluids and some medications to kickstart the process of putting you to sleep. So as you're about sleeping, oxygen will be given to you for a few minutes. Now, they will use this to give you oxygen just over your nose with the aid of this. This is connected to this and is placed over your nose for a few minutes to administer some oxygen. Once you sleep and oxygen has been administered to you for some minutes, you would be intubated. By intubation, I mean an endotracheal tube is passed down your mouth into your airway. That is after your positioning, your head and neck positioning has been assessed well for an easy passage of the tube. With the tube, gaseous anesthesia and oxygen will be administered to you all through surgery. Again, while surgery is going on, the work of your anesthetist is to make sure that you are safe. So there's going to be a continuous monitoring of your vital signs. This behind me is what we call the patient monitor. It helps to monitor your oxygen saturation. It helps to monitor your blood pressure, your heart rate, your temperature, everything that looks like a parameter or a pointer to the fact that while under anesthesia, while unconscious, you are safe. The anesthetist monitors you with the help of the patient monitor. As surgery is going on, intravenous fluids will also be continuously administered to you. Your urine output is also going to be continuously monitored because as fluid goes in, fluid should go out. So there's what we call the input-output balance. It is the function of the anesthetist to make sure that your input-output with respect to fluid is very, very balanced. Most surgeries will naturally bring about blood loss, but what the surgeon or the anesthetist or the whole surgical team does not want is that you lose blood outside the limit of safety. So, in conjunction with the surgeon, it is also the function of the anesthetist to assess blood loss so that if there is a need for blood transfusion during surgery, the anesthetist can transfuse you. Now, once surgery is over, the anesthetist will give you some drugs to reverse the effect of anesthesia. He waits for a moment while assessing that your reflexes are back. Once he's comfortable with the reversal of your reflexes, he's going to talk to you, give you some commands to which you would respond. Once you respond, it means that it is time to extubate you, to take out the tube in your throat through which oxygen and gaseous anesthesia was continuously administered to you during surgery. As this is going out, your vital signs are still continuously monitored. Once this is out, the anesthetist continues to interact with you, to talk with you. With your response, the whole surgical team is happy, surgery is successful, there are no complications from anesthesia, everybody is happy, and you are moved to the recovery room. You wake up fully conscious at the end of the day, because in the immediate postoperative period, you could still be groggy, you could be drowsy. But a few minutes into maybe an hour or so, you would have fully recovered from anesthesia. You see yourself back in the recovery room. You are happy that surgery is successful. So with this information that you know, you don't need to be scared. of general anesthesia. If at this point in time you've not subscribed to my channel, I implore you to please subscribe, like this video, and make comments in the comment section. I will be happy to respond to every one of them. And I will see you in the next video.